So the first COVID dashboard was super basic. We developed it within a couple days during the start of the pandemic because it was a need. Since then, we've gotten to have a bit more practice with dashboards and build our skills. And today, we have an integrated respiratory pathogens dashboard that incorporates not only COVID data, but all sorts of other respiratory pathogens.
It was great to be able to have access to some hyperlocal data sources from partners that we had been working with during COVID, and we were able to transform those partnerships into getting data for this more general respiratory dashboard.
Air monitoring works because every time we breathe, we exhale little particles. Those little particles include spit and saliva and mucus, and it can also include viral genetic material. We've been doing this air sampling since 2021, and last summer when PHMDC approached us about putting the data on the dashboard, we were thrilled. This becomes a new way that we can add another layer in a Swiss cheese model of data that people can use to make informed decisions for themselves and their families.
Orchards is a school-based program that focuses on respiratory infection. Well, we're totally excited to see our data being used in a wide community approach to help provide some background and warning about influenza.
That was a really valuable experience to have the state and local health departments working together on this project. I think it was an exciting time because we at the state were working on a dashboard as well, a little bit behind the county's project. So we were able to learn a lot from the experience and then hopefully also impart some lessons learned from our own experience and our own experience working with the surveillance data. So I think it really helped strengthen both projects.
Traditionally, public health, I think, only really had contact with healthcare when it came to reporting reportable conditions. I think the pandemic really pivoted the relationship and turned it towards more of a data sharing relationship, and also I think highlighted that we had more common interests at the end of the day.
Probably the biggest part of developing the dashboard was figuring out how to combine all of these different data sources into one cohesive dashboard that was accessible and usable to the general public.
Essence is unique because it's almost real time. Emergency departments upload data throughout the day, and so we're able to track things really quickly. With traditional reporting, people have to go to the doctor, get tested, then we have to get the test result back, and so it takes longer. So Essence is nice in that it's quicker.
Another really important factor that I think elevates our dashboard is the design and the intentionality with which we built it.
We interviewed 8 different people who are stakeholders in the community and made sure we knew what they wanted in a dashboard so that we could implement those things throughout.
I like that you have the weekly summary on the very first page, so I just look at that and, immediately, I have what I need.
What I really like about the Essence data also is that we're able to parse it by age group. So if you're interested in what's going on among preschool age kids or older people, you can find that out.
Like how we're able to break out our primary population concern, 65 plus.
Well, we've been very excited to see the beautiful integration of many different streams of data to make a very, very nice whole and complete picture of what's going on.
I just really admire and am inspired by my coworkers every day, and just the expertise and knowledge they bring to the space I think is really impressive.
I'm so delighted to have the opportunity to work with PHMDC and our other partners because we really are an extremely strong community, and we're stronger yet when we work together.